We're here to talk to you a little bit about clinical and counselling psychology. My name is Dr. Payal Amin-Lindsay, and I am one of the principal counselling psychologists that works with clients with severe and enduring mental health difficulties in one of our adult community mental health teams.
And hi, I'm Dr. Faye Barrow. I'm a clinical psychologist, and I also work in one of the adult community mental health teams in Berkshire NHS Foundation Trust. Okay, let's go on to the next slide. Lovely, thank you. So I'm going to talk a little bit very briefly about some general points around the professions and what that looks like. Obviously, this is all information that you can seek more information about if you'd like to. But just to talk a little bit about the range of settings that you might expect to work in if you are interested in becoming a clinical counselling psychologist. So obviously, as both Payal and I do, you can work in the NHS, and there's a range of different settings within the NHS that psychologists work within. There's also forensic settings, or private companies. Interestingly, the banking industry or occupational health departments also employ clinical psychologists and counselling psychologists at times. Some people work in private practice, and actually oftentimes we see people working in private practice as well as working in some of the other settings as well. There's educational settings and there's academic settings, so that could be as a university lecturer or as a researcher. So it depends on your specific interests as to which of those settings might be most suited for you and your career. Okay, next slide, please. So the most common things that we do, and obviously it's a very broad range of things, so it would depend on the job role and the organisation that you work within, but most commonly, and we're speaking from our own experience really, because we work in the NHS, we would be seeing clients or patients, as we might sometimes call them, offering therapy. And that can be in a range of different modalities, so it could be individual or groups. And the part of the training process is learning about how exactly to do that and what that looks like, teaching skills and helping people to explore their experiences in a way that is hopefully helpful to them. And part of that experience is also keeping clinical notes and writing reports as well. We have a structure for what we call supervision, which is about how we support each other in the roles that we do in these settings. And it's part of being a clinical counselling psychologist is to provide that support to each other. So that's usually written into most job roles. We usually have a teaching or training element to job roles. And we offer support more broadly as well to our colleagues in whichever team we might be working within. Research and audit, again, dependent a little bit on the role, but often there's a research or audit element to the work that we do. And equally, service improvement and development can be an important part of the work we do. It's worth just noting, as it says at the bottom here, that the balance of roles will vary depending on the seniority level of the work that you're doing, and which obviously will change over career, as the career progresses. Kind of mentioned there about professional banding within the NHS. So if you want to look up a little bit more about what that means, that's the agenda for change, kind of seniority level that is within the NHS structure. So feel free to look that up if you'd like to. Okay, next slide, please. So the other skills that we need and use very regularly would be good communication skills. Obviously, a lot of what we do is about communicating with each other. Time management, very important. We're busy folk, so it's good to be able to diarise, as I call it, have a good diary strategy. It is emotional work, the work that we do, and so being able to have some coping strategies to manage your own emotions can be very helpful, and sometimes people choose to access therapy themselves at various points throughout their career. It's also helpful to be thoughtful around written work, and we do lots of report writing, and that can be for, depending on the job role, but that can be for quite formal reports for things like, for example, court hearings and things like that. So experience of writing reports can be very useful. Research skills, similarly, I spoke to that earlier, and management and leadership skills, sort of thinking about how we promote ourselves, how we are leaders within the teams that we work in. So all of these are helpful skills to be thinking about and to be thoughtful about if this career is something you're interested in. Okay, we'll go on to the next slide, please.
So I'm just going to speak with you a little bit about clinical and counselling psychology and maybe the similarities and the differences. We've outlined this a little bit more in the leaflets that we've got. So we've got a leaflet on clinical psychology, a leaflet on counselling psychology, and also a frequently asked questions leaflet, which goes into this a little bit more detail. But in essence, you know, the differences with clinical and counselling psychology have probably narrowed across the years and really lie mainly within the historical philosophies and the training and funding arrangements. So, you know, when I talk about historical philosophies, I'm just talking about how they were created and born. So clinical psychology was kind of born kind of within the NHS, whereas counselling psychology was born outside of the NHS. And that kind of connects, I guess, to the funding platforms. So clinical psychology is a funded programme. You are funded for 3 years of your doctorate, whereas counselling psychology is self-funded. And, you know, the changes, the differences, within the training structure is that, for example, in clinical psychology, your placement structure is organised by the university, and you will always have quite a similar placement structure in that you will always get experience of, you know, working in older adults, working in working age adults, working with children, and working with people with learning disabilities, and those placements are within the NHS. Whereas with counselling psychology, your placements are self-directed, and so you can choose your placements in line with your special interests, and that may be within the NHS or it may be kind of outside of the NHS. And the kind of pre-training requisites and the experience that you might require, they're very kind of similar. There may be some unique variations within both programs, but as you can see, as we go down the pyramid, we can see that actually the similarities when it actually comes to qualifying and your opportunities kind of within the job role are very much the same. So you would always, as a clinical or counselling psychologist, qualify at band 7 on the NHS agenda for change, and you would have the same opportunities to kind of progress within your job role. And what we do on a day-to-day basis, as we've already explored earlier, is very much the same. In terms of how to gain experiences, that we've just kind of outlined here for you a range of options. Again, as previously, it's not exhaustive. There are lots of other ways, but really look within the voluntary sector, you know, thinking about what exists in local areas or kind of in the community that might help you to gain experience of working with people. So that might be individually, that might be with families or groups, you know, thinking about befriending services, support lines that exist out there. Within the NHS, there are various roles that kind of exist. So a support time and recovery worker would be a possibility, you know, a mental health wellbeing practitioner, thinking about the psychological wellbeing practitioner role within IAPT itself. You might choose to work as a healthcare assistant to gain that experience. I think what is most commonly considered as experience as assistant psychologist role or an honorary assistant psychologist role, and whilst that is ideal, you know, I would really encourage you to think about the variety of options to gain experience, and of course a research assistant role. And in other areas, you know, support worker in residential settings, thinking about peer support worker at university, thinking about some agency care work, and then in order to gain that experience of research, you can kind of consider roles within the NHS or academic institutions. You know, what might increase your chances? It really is about getting a range of experience, you know, thinking about diversifying that. So thinking about mental health services, learning disabilities, you know, drugs and alcohol, thinking about therapy experience. The weighting of this for counselling psychology is probably a little bit more than it is for clinical psychology, but still both equally important. So thinking about working in IAPT and how you might be able to get therapy experience there, thinking about group interventions and support groups that you might be able to get involved with. thinking about that research experience, research is a core component of both training programs. So again, if you can get research experience prior to getting onto a doctoral program, that's only going to help your application. And postgraduate qualification as well. So some people choose to go on to do a master's before they apply for their doctorate. Some people, especially those that might be thinking about counselling psychology, might do a counselling skills course. And it's just really important to say that, both courses are really competitive, and it's not uncommon for people to apply several times before you get on, and that was certainly mine and Faye's experience ourselves. And so the more experience you can get, just the better. Faye.
Lovely, thank you. So we thought it might be helpful just to talk a little bit about our journeys, how we came to be here, how we came to be do the professions that we do. So just to give a broad overview, so I did my undergraduate degree in Bath University, and I completed that in 2008. And then I had a varying range of clinical experiences, both paid and unpaid at times, part-time and full-time. And I did assistant psychology roles for 5 years, and which, to be honest, I really enjoyed, and was somewhat a little bit sad to leave in some ways. But yes, I'll talk a little bit about that more specifically in a minute. And I applied 3 years running for the doctoral clinical psychology course, and wasn't accepted. So I actually was accepted on the 4th application. And each time that I wasn't accepted, the kind of request was for more experience, usually for a breadth of experience. So asking for kind of a broader range of skills to be shown on my application. Okay, next slide, thank you. So to give a little overview of some of the work I did before I was accepted onto the course. So I did a good amount of agency care work in a real range of settings. So I just signed up to some care agencies and just picked things that I thought gave me a whole range of experiences, really. So some of that was working with older adults, some of that was working with people with learning disabilities, and some work with vulnerable children as well. So yeah, kind of just trying to find out as much as I could about what it would feel like to be in the care industry. That is ultimately where we are. I was lucky enough to then have a support worker role, and I was a reader, which is a bit of an unusual role. I was supporting a clinical psychologist, a consultant clinical psychologist in her role. She was partially sighted and so required some kind of support in her role. So that was really helpful, kind of shadowing her, learning about what a clinical psychologist does, and some of the things that she was requiring help with. So that was a really interesting experience. Alongside that, doing a support worker role with people who were experiencing psychosis, and that was kind of working in the community. I then had various assistant psychology posts, and kind of speaking a little bit to them there. So I was in a learning disabilities team, in a specialist children's OCD clinic, and in an inpatient setting as well. And that was really kind of about getting the breadth of experiences. And a lot of that work was really, really varied. And I think that was key to me being finally accepted onto the doctoral course, was just having such a range of experiences. I just want to mention there as well that so many of those posts are only a year long, but actually I don't think that's a bad thing. I think that there is something about kind of forcing yourself to move on a little bit in order to get that kind of range of experience. I was accepted onto the Oxford Clinical Psychology doctorate course in 2013, and as Payal kind of mentioned previously, under the Clin Psych course, your placements are kind of provided for you by the NHS, and that included for me an adult placement, a child and adolescent placement, an older adult placement, and learning disabilities and specialist systemic experiences as well. Okay.
just going to speak to you briefly about my journey. So I completed my psychology degree in 2002, and then I directly went into a paid support worker role with adults with autism. So this was in a residential service, and the role was very varied. It would involve a lot of kind of hands-on care, washing and cleaning and bathing and cooking meals and that sort of thing, but also kind of taking them out in the community and really trying to improve their quality of life by engagement with the outside world. And although it started off not being, connected to psychology per se, I was able to use my psychology degree within the job role to really think about how we could develop and assist with kind of behavioural incident management plans. So, very much trying to think about what could we do before an incident occurs to prevent it from occurring. And kind of thinking about triggers, thinking about kind of behavioural signs that we might see quite early on, and intervening at that stage in a kind of quite low arousal, positive risk management way to prevent risk, really. And alongside that, I was volunteering with children with disabilities. There was a kind of social club, I guess you would describe it, attached to a college for children with disabilities, and I would volunteer there. I then went on to do a counselling skills course through Regent's College, and that was on the weekends largely, quite an intensive course. And following that, I applied for the counselling psychology doctorate, both kind of just a year after I completed my degree, really. And I wasn't accepted, which at the time was really hard to swallow. But I think in hindsight, the rationale given, which was that I needed more kind of practical application and experience, I think was appropriate. So I then sought to get that, really, and here's a range of ways that I did that. So I kind of volunteered with Anxiety Care UK, really thinking about, I started doing their volunteering course, and that then led me to co-facilitate their mental health support groups and offering kind of one-to-one anxiety management sessions, not dissimilar to what a support time and recovery worker would do, kind of really just thinking about those very basic anxiety management skills, graded exposure, kind of ideas. I then kind of got an honorary assistant psychologist position. So when I say honorary, that is volunteering, it is working for free, but that helped get my foot in the door in the NHS and helped me just really think about how psychology is applied in that area. And the role within that was kind of just looking at outcoming a particular intervention that they had developed, thinking about how effective it was from the outcome measures. And as part of that, I just had the opportunity to shadow kind of qualified psychologists in their assessments, in their referrals meeting, just to get a bit of a sense of how do psychologists work in practice. Volunteered with a local support group, a mental health charity called Corner House, and was just facilitating support groups with them and stay in chat sessions, just staying there and being there for a bit of a chat with people with mental health difficulties. I then applied for the programme again, the Counselling Psychology doctorate again in 2004, was accepted and began the programme. And then alongside that, I did the Place to Be training, which is organised by Place to Be, if you've heard of that as an organisation, and that was about becoming a volunteer counsellor within schools, and that became my first year placement on the programme, on the doctorate. And then other placements that I did following that was obviously within the primary school, adult community mental health teams, primary care psychology service in the days before IAPT, and a specialist OCD clinic. And I suppose from my perspective, I think what's important just to highlight is throughout my doctoral programme and throughout the experience that I gained before I got onto the psychology doctorate, was I continued working as a support worker, because I think one of the challenges on the counselling psychology programme, as we've said, is that it is self-funded. So in order to support myself to be able to do that, I continued in my paid support worker role, and I was just fortunate that because it was shift work, I was able to condense my shift work into kind of Friday, Saturday, Sundays, and then kind of be at university and be on placements for the majority of the week.
So just to give a little bit of information about where you might go if you want to read a bit more about some of these things, or indeed if you wanted to look up kind of where you might go to find some job roles. So we'll leave those up there for you to take note of. As Payal spoke to before, we do have some leaflets that we've created and we hope will work alongside these videos. If you would like a copy, they should be on the website, but you could also email us, and the email address there is careersevents@berkshire.nhs.uk. So please do drop us an email, and we'd be happy to send those to you.
So thank you for taking the time to listen to us. We hope that's been really helpful to you, and we hope that's helped you consider kind of clinical or counselling psychology as a profession. We will be releasing some dates for some meet and greet sessions shortly, so that just gives you the opportunity to meet with myself and or Faye and perhaps some other clinical and counselling psychologists, just to ask any personalised questions that you may have, and we'll get those dates up soon. Many thanks for your time. See you soon. Bye.